Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today.
Breastfeeding is the furthest thing from selfish. And no one who has ever breastfed or struggled through breastfeeding would appreciate being called selfish.
You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Palladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you.
Welcome, everyone, to this week's episode of the Tongue Tie Experts podcast. I'm your host, Lisa Palladino, and today I want to talk about something that's near and dear to my heart for both professional and personal reasons. The topic is pain and nipple pain. But the issue of nipple pain I want to talk about today is a little bit of a different slant than I usually hear talked about. Today, I want to talk about the dismissal of nipple pain or the dismissal of a woman's experience breastfeeding as selfish. Yep, can you believe that? Some people think that a woman wanting to breastfeed her baby is selfish. We're going to unpack that a little bit. So, just in case you don't know me and know completely about me, I've actually written a book called It Shouldn't Hurt to Nurse Your Baby. And that link is always in the show notes. It's always in my link in bio. It's on Amazon. It Shouldn't Hurt to Nurse Your Baby, Healing the 6 Most Common Causes of Nipple Pain. So yes, tongue tie, lip tie is one of them, but it's not the only cause. And it's not even the first cause that I write about because there are so many things that can cause nipple pain. But let's talk about why I'm upset about some things that I've heard and where have I heard them. So over the past couple of weeks, I've been on social media a lot. You know, the holidays, not really working, and there was a lot of activity around breastfeeding and tongue tie on social following some publicity. And I got into the weeds of a comment section. Actually, there were two different places where this happened. In the comment section, where people were framing a mother's desire to feed her baby as selfish. And I thought we were so far past that. The arguments were ridiculous. I mean, it was on both sides. It just got like really icky. And I didn't even get involved in the conversation. I decided to take a step back, take a deep breath, and think about what I really want to say on this topic and how I didn't want to argue with ignorant people. So, yes, excuse me, if you believe that breastfeeding is selfish, I am calling you ignorant. Breastfeeding is the furthest thing from selfish. And no one who has ever breastfed or struggled through breastfeeding would appreciate being called selfish. There's many reasons that we breastfeed our babies. For our own needs, I don't know. I never heard that one. So let's talk a little bit about how far we've come. And I guess we haven't come far enough. So when I first released my book, It Shouldn't Hurt to Nurse Your Baby, I got a lot of feedback. I got a lot of negative feedback because people were saying that it always hurts in the beginning. And it doesn't always hurt in the beginning. A couple points I want to make about that is if it does hurt, there is always a reason to investigate why is it hurting? What can we do about it? What's going on that it's hurting? Is it a position? Is it something going on with the mother's breast or nipple? Is it an infection? Is it yeast? Is it a vasospasm issue? What is the cause of the pain? Is it a shallow latch? Is it an infant who can't turn his head to the side that mom is trying to get him to turn his head to so his mouth isn't opening, his or her mouth? So there are lots of things to investigate when breastfeeding hurts. There are lots of things to do when breastfeeding hurts. Sometimes this includes tongue-tie evaluation, assessment, and treatment, but not always. There are lots of reasons why nipples can hurt. I'm going to back away from that and say that I think that the reason that so many people get offended when I say breastfeeding shouldn't hurt is because they were told that it would, and it did, and they either judge themselves or judge other people for how they react to the pain. So if it hurts to nurse your baby, do you continue? Some of us do, some of us don't, right? I've been there and gave up. And I feel terrible about the baby that I didn't breastfeed because of how she was latching and what was going on and the fact that I had no help. Now, according to some of the comments that I read, if I would have at the time sought out or found the help of a professional lactation consultant and did things to make things more comfortable for me, that would have been selfish and ridiculous. I don't understand that. I truly do not understand that because some of the people were saying things like, you can pump and give a bottle, which is a lot harder than it sounds and takes away some of the benefits. No offense to you pumping moms, no offense at all, but at the breastfeeding, when possible, is ideal. And we are talking here about a woman's innate desire and her own goals, right? But the goal isn't coming from a selfish place. The goal is coming because she knows on an instinctual level and on a intellectual level, and she has read and done her research, and she has decided that this is how she wants to feed her baby. If it hurts, what should she do? If she stops, that's being kinder to the baby and better for society, then getting help. I'll talk a little bit about lactation consultants in a minute, but I'm going to talk about my own experience, right? So I stopped breastfeeding that baby. I had no support and I stopped. And, I'm going to hopefully not get teary over this. I've regretted that since then. And she's turning 30. I had no help. I had no support. My pediatrician told me that I was torturing myself and wasting my time trying to breastfeed my baby. So I stopped. Now we have professionals that can help with breastfeeding, that can make it more comfortable. And these professionals are being denigrated for their expertise. IBCLCs are professionals who have lots of education, lots of hands-on training, lots of experience, and care deeply about what they're doing. If they didn't care deeply, they would not be doing this, because this is not an easy profession at all. Very rewarding on a level that's different than financial reward. Very rewarding. When I began to work in this field, I quickly realized that school didn't teach me enough about tongue tie. I wanted the opportunity to learn firsthand from an experienced professional. I had so many questions. Can you relate? Good news. I've created the Professional's Guide to Tongue Tie in the Breastfeeding Infant just for you. You'll get 4 recorded video modules, downloads to share with your patients, admission to a thriving multidisciplinary community for networking, sharing, and continued learning, and 4 LSERPs. All the details are on the website at tonguetieexperts.net/pro course. Use code podcast15 to save 15% off this and all of my courses. Can't wait to see you in the group. And some of us make damn good money for what we do. And why shouldn't we? To be honest with you, if I could go back 30 years and hire a lactation consultant, if it took me a month's salary to pay for her, it would have been worth it to me if she could have solved my problems. It's just the facts. We deserve to be compensated. Now, do we deserve kickbacks? No. And honestly, I know hundreds at least of lactation consultants, IBCLCs, and I don't know anybody getting kickbacks from doctors. Not one person. So I don't know where that came from. I can't speak for everyone. I can't speak for every profession. But in general, we should be celebrating the fact that since 1985, there is a profession that can help families reach their breastfeeding goals. Because breastfeeding changes the world for that parent, for that baby, and for our society. Now, who would want to stop that? Who would want to stop that? That's a story for another day. But just look at the sources of where the information is coming, and you may get a little bit of a hint of who may want to stop breastfeeding. So, got a little emotional there. Sorry about that. Sip of water. Coffee. Should be water. So I'll calm down a little. Let's talk a little bit more. Let's get back to the issue of pain and what pain means. If a person who is nursing is having pain, it's also a sign that something isn't being effective in breastfeeding. Here's where the selfish comments get me a little bit annoyed, or more annoyed. It's not just about the mom. This is not just about the mom and her comfort. If the latch is not comfortable to mom, it's because the infant is not feeding effectively. That same baby may also, and often, will not feed effectively from a bottle. So now what? But I digress. This is not just about breastfeeding. This is not just about, well, choose another way to feed the baby. This is about, let's make things as easy and effective and comfortable for the mother and the baby. And there's nothing selfish about that. When a newborn, especially, is trying to get milk from a newly engorged breast, I'll give you an example. So milk just came in. Mom is very full. There's tons of milk there, and baby's trying so hard to get it. Baby's rooting and baby's hungry, and they latch on just to the nipple and they chomp down on that mama's nipple. And it causes a lot of pain and very quickly can cause damage to the nipple. Cuts, bleeding, the whole thing. The other thing that happens when we do a weighted feeding with that baby is that we see very little milk transfer. So the baby nurses for a half hour, transfers maybe a half an ounce, mom's breasts are so full. We change the position a little bit. We get the baby to open their mouth wide. We get the baby in a position where they're, not to talk too much about position, but chin in, nose out, wide open mouth, deep latch, more than the nipple. Get that baby, the mom's nipple deeper in the baby's mouth. Now, all of a sudden, it's comfortable for baby. And guess what? That baby transfers 2 to 3 ounces in 10 to 15 minutes. Everybody's happy. Now, if we said that the comfort was just for mom, we would assume that baby's getting no benefits to making the latch more comfortable. And the baby is getting benefits for making the latch more comfortable. It's making it easier for them to feed. So this is not just about mom's comfort. This is about effectiveness. It is not selfish to continue to breastfeed. It is not selfish to get help to breastfeed. It is important and vital to realize that nipple pain can be caused by tongue tie. Investigation, assessment for tongue tie by someone who understands the function, and a functional exam is vital. Release may be warranted, but treatment is warranted. And release or frenectomy is not the only treatment for a tongue that is restricted. It may be the last part of the treatment. Treatment might be immediately warranted, but in most cases, there's other things to do to prepare. So this is why I teach. This is why I have this platform. This is why I interview experts. Tongue tie experts is not about me. It's about everyone who experiences tongue tie, whether you're a professional, whether you're a parent, whether you're a dentist, whether you're a doula, and everything in between, right? This is about all of us who know that there is so much nuance in this field and so much that's important in this field. And for parents to feel supported in all of their decisions, parents should feel supported and assisted to reach their goals, no matter what their goals are. So if a mom says, you know what, I don't feel like going through this, I'm just gonna feed a different way and it works, that's her choice, right? I'm going to go out on a limb and say that might be the selfish choice. Not for everyone, but that might be the selfish choice. It was definitely at that point when I decided to stop nursing my infant, it felt selfish to stop nursing my infant, not to continue, as some people have been insinuating by their comments, or not just insinuating, stating that treating a baby for tongue tie is a selfish thing. It's not. So anyway, thank you. Thank you so much for listening today. It's always a pleasure. I appreciate your point of view, and I want to hear your stories. So feel free. I'm going to be doing a series. I really want to do a lot of parent stories. I have some parent stories in some past episodes of the podcast, but I definitely want to be doing some more parent stories. So if you have a story you want to share, please feel free. It doesn't have to be a happy ending. I just want to hear your journeys. So you can email me at lisa@lisapalladino.net, or you can send me a private message. It's better to email me though. But on Tongue Tie Experts, I can get private messages, but email gets less chance of getting lost. So thank you so much for joining. As always, I am very grateful to you. All of the links that I've mentioned here today will be in the show notes. The book is a really handy little book. Shouldn't Hurt to Nurse Your Baby, Healing the 6 Most Common Causes of Nipple Pain. It's a great book. I give it out to every patient that comes in because it's inexpensive, it's handy, it's easy, and it just helps with nipple care. Anyway, so that's my story. Thank you so much for being here today. Thank you.
Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue Tie Experts Insiders. It includes monthly online meetups with me, Lisa Palladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue-tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.